So, what is measles? Is it a viral rash, right? Okay, so we have RCH, and yeah, it also have some points, and we have this one. Okay, Victoria infectious disease, the guideline. It has like a good explanation and everything in here. So, what are the features of measles? Tell me, what are the features of measles? What is the causative agent of measles? Tell me. Okay. Measles, you should know it's a notifiable disease. Okay, it's a notifiable disease. This topic has like repeated in different way in November exam. Okay, sure. Here, like this question with travel history, present with cough, coryza, and bilateral conjunctivitis. What to do? Like there are different things. Okay, different questions we got in here. So in November, and this is sometimes they can repeat this in uh, February as well. So this is very high yield. Okay. So who is the infectious agents of measles? So measles rash caused by the measles virus, a member of genus mobilivirus in the sorry, Paramyxoviridae family. Okay, Paramyxoviridae family, and caused by measles virus. Yeah. Then this is a notifiable disease. Okay, please remember it's a notifiable disease. Yes, scarlet fever also notifiable disease. Yeah. Then so what are the clinical features? In here, in the measles, we remember clinical features as how? Three C's, right? Three C's. For scarlet, we have four A's, but in here, for the scarlet fever, we have what? We have, so not the scarlet, so measles, we have three C's. So what are those three C's you can remember? Tell me what are those three C's? Tell me, doctors. You don't know these three C's? Mm-hmm. Yes. It's a cough, coryza, and conjunctivitis, right? Cough, coryza, and conjunctivitis. Okay, let's discuss about clinical features. Let's discuss about the clinical features. So, clinical features of measles include prodromal fever, a severe cough, conjunctivitis, and coryza in moderately unwell child or adult. Coplic spots may be seen in the buccal mucosa. So, prodromal symptoms usually last for 2 to 4 days. I'll show the coplic spot. It's a good picture here. You can see this coplic spot. Okay, coplic spot in measles. Here, this is the coplic spot. So, please remember here, coplic spot. Yeah, here, coplic spot in tongue. Yeah, like that. Okay. So give me 1 minute, doctors. I don't know. I'm having allergic rhinitis every day. I don't know why. There is some allergen in here. Okay. Sorry for that. Okay, so these are the complex spots. Then what else? So, so prodromal symptoms usually for 2 to 4 days. Okay, then the most important clinical predictor are included in the clinical case definition for measles, which is an illness characteristic by generalized maculopapular rash, usually lasting 3 or more days, and fever at least 38 Celsius if measured, persist at the time of rash onset, and cough, coryza, and conjunctivitis or complex spot. So this is very high yield. So please remember, okay? So please remember these features, right? Okay, then because in October they have given some scenario like the lymphadenopathy and this fever and rash, okay, and we have differentiate from this measles rubella and from the roseola infantum, right? I hope you remember the October record. In that case you should know when is this rash appear. In here it's rash appear present at the same time, right? So same time with the fever. So please remember these features. And the characteristic rash appear 2 to 7 days after onsets of uh, prodrome. It's begin in the phase. 1 minute. Here they have mentioned the same time rash. No, doctor, here. So, even though they have mentioned in here, fever at least 30 years if measured, present at the time of rash onset. Okay, yeah. Sorry. So, they are mentioning here. I have to check it with this one as well. Okay, the symptoms. Okay, initial symptoms. These are. Yeah, okay. So, here, doctor. Uh, don't confuse the these features first appear these features and it can have like 3 days of 2 to 3 days of symptoms, then after 2 or 3 days distinctive rashes appear. Okay, so please remember these points. Yeah, not at the same time. Okay, then what else? So signs and symptoms. And it can take around 10 to 12 days of symptoms to appear after exposure to the measles virus. Most children with measles are sick for less than a week and should start feeling better about 2 days after, 2 days after their rash appear. Minute, I'll show the rash. Okay, here you can see this is the measles rash here. Okay, here you can see maculopapular rash. So again, I'm telling this because in the beginning, due to this one, uh, it's okay. So remember this like that. Okay. In here, uh, the measles we have fever, cough, runny nose, sore throat like corazza symptoms, and not conjunctivitis, traces, conjunctivitis, coryza symptoms, and severe coughs. These are the traces, and with fever, temperature 38 or more here. And you have to remember first these symptoms, and then Rash appear after like 2 to 3 days or 3 to 4 days after. But they are mentioning in here at the same time the rash appear also fever can be present. Okay, fever can be present. That's they are mentioning in here. Like not like this rash appear at the same time with fever. Okay, so first fever and these traces, then after this rash can appear. Okay, but at the same time when the rash appear, these fever can be present. That's what they are mentioning. So this is correct, not wrong. Yeah. Then other symptoms include anorexia, diarrhea, especially in infants, and generalized lymphadenopathy. We can see. Okay, so please remember these features about this lymphadenopathy as well. So we have Koplik spots, lymphadenopathy, erythematospacular papular rash, and 3Cs, right? Yeah. Then, mm, what else? And there's one more thing you should know. So diagnosis, what we can do for the diagnosis. So local public health units can provide advice, recommendation, testing for measles. So serology demonstrate the measles IgG antibody and detection of measles RNA polymerase chain PCR. We can use PCR, viral culture, serology, but they are usually not asking about this part. And what else we should hear? They have given serology and everything. You can give it a read. Then what is the incubation for the measles? It is approximately 10 days, but varies from 7 to 18 days. Okay, so remember. And in here, measles transmission, how it's transmit from say airborne, right? Airborne virus, and virus can survive in the environment for up to 2 hours, allowing for transmission in the absence of direct contact with infectious cases. Okay, so yeah. Period of communicability of measles cases are infectious 24 hours prior to the onset of prodromal symptoms until 4 days after onset of rash. Where the prodrome is undefined, the onset of infectious period should be considered to be 4 days before the onsets of rash. Okay, then and we you should remember the same thing they have mentioned, and now it breaks. Yeah, and there's one more thing you should remember in measles case. In some cases, 1 minute, doctors. Yeah, sorry for that. In this measles case, you should know school exclusion, and you should know like there's a one more I'll explain from here. Okay, okay, before that, tell me what is the school exclusion criteria for measles? Tell me, type in the chat. 4 days mean what? 4 days. Okay, what about other doctors? What about other doctors? Here, school and child care. Okay, Although outbreaks mainly affect unvaccinated children, highly vaccinated school, 1 minute, doctor. Doctors, can you take 5 minutes break? I'll come back. Okay, give me 5 minutes.